All right. And real quick, there's a lot of background noise with you, so I'm just going to mute you real quick if that's okay.
Where are
And
you
just,
actually, just physically? I mean, are you in Atlanta or Tampa, or
I'm in
where do
Tampa.
you? You're in Tampa.
Hmm.
Uh, I lived down there near MacDill Air Force Base for 7 years.
Oh, really? Yeah,
Yeah,
that's where I live too. So,
yeah, it's beautiful down there. Just
yeah.
beautiful. Had a lot of money on that house too.
All right. So, okay. All right. So we're recording. All right. So what we want to walk through today is RCP's remote patient monitoring platform, and then what we've built out, and then how we help healthcare organizations not only utilize the technology to monitor their patients, but also track all of the remote clinical actions that are taken during that said monitoring time, and how that ties into the Medicare billing codes and just the general billing codes for private insurance that are involved with these types of activities for patients. Now, the whole idea of remote patient monitoring has come into existence in the past few years. It's a Medicare-led program with the overall idea of bolstering that relationship between the patient and their primary care physician. Basically what Medicare is doing is it's compensating physicians more per month on every patient that they monitor. And so what they mean by monitoring is giving the patient devices to put in their homes, be it a scale, a blood pressure cuff, pulse oximeter, spirometer, thermometer, what have you, that is relevant to not only the overall well-being of the patient, but also if they have a chronic condition, something that helps track their actual status within having that condition. And so what I'm going to walk through you here today is I'm going to show you how RCP is your technology vendor, and the two aspects of the program being one of collecting the data from the patient, and two, as a physician or as a practice, having you and your staff being able to not only monitor that data, but allow all of the logging of the activities that are taken in the time spent monitoring the patient's data and speaking with them, and then how all that ties in to the specific billing codes involved. So the idea overall is that the Medicare is basically compensating the primary care physicians more to take that preventative medicine route with their patients, meaning they monitor them daily. Their patients take device readings on a regular basis, and the doctors and their staff are monitoring the patient's condition and basically getting ahead of any issues that might result in that patient being hospitalized. And basically the general idea is to lower the cost of care given to each patient. So Medicare's bet really is they're going to compensate the physicians, around $1,500 a year for each patient to try to prevent that $100,000 hospital visit. So the way it works is this is what the portal looks like. You log in, and you have a list of all of your patients that you have on the program. Now, when you see here, you can see that the patient's name, their medical records number, and which programs they're involved in. The RCM is what we're going to focus on today, and which is the RCM is the remote care monitoring or management. And so what we're doing is that's including the devices. So it has the patient demographic, contact info, and then here is the icons of which devices they have registered with them. And then also you see here on this time, that's the amount of time that has been spent with that patient for this particular month. These numbers are pretty low right now since it's the very beginning of the month, and I will show you how that ties into the billing portion of the program. So when you have your patients here, we'll go into one of the test patients, and once you come into the test patient, you'll see their patient demographic, all of the assigned devices they have, and if they have any check-ins. These are automated phone calls and text messages that get patient-reported data collected. We can go into that at a little later, but what we're going to focus on here on the devices. And you see here, every single patient that's going to be involved with Remote Care Partners is going to have a hub. And what this hub is essentially, it's a device that we manufacture ourselves that is basically it's a processor with a cell phone SIM card attached to it. And it has a Bluetooth receiver that speaks to all of the devices that are going to be attached to that particular patient. So say you want to give your patient a pulse oximeter and a blood pressure cuff. Both of those devices are going to be paired with the hub prior to arrival at the patient's home. And what the reason for this is, this allows the patient to have very little to no setup. And what we mean by that is the only setup that the patient has is literally plugging the hub into the wall. And then the hub has a speaker on it that will tell the patient the hub is powering up. And then what it does at that point is it connects to the strongest cellular signal. So it's not going to be going through Wi-Fi. It's not going to, the patient doesn't have to set up a Wi-Fi signal or anything like that. They don't have to set up any type of internet connection. The hub does this automatically over a cellular network, just like a cell phone. And your hub is prepared to all of the devices that are attached to it. So now once the patient plugs the hub into the wall, the only thing that they need to do is use their devices moving forward. The devices are going to arrive to the patient with batteries in them. They're already going to have, they're already going to be paired to the hub. And every single time that a patient utilizes a device, the hub will recognize said device and give instructions to the patient on how to utilize it. So for example, if they use a pulse oximeter, the hub will say, your pulse oximeter has been detected. Please remain quiet and still for the next 20 seconds as we take your reading. And at the end of the 20 seconds, the hub will say, thank you for your reading. And that pulse oximeter reading will come through to the device here, and it'll have a timestamp, and it'll show you all of the readings that were taken with that particular, at that time. And you see here that we have an indication of low. Now, every device that a patient receives is going to have a range. And this is going to be specific just to that patient's device for that particular patient. Everybody has a little bit different standard on readings. So what would be called the normal levels for that particular patient. You set that range here. And what happens is, if a patient has a reading that is outside of that norm, you will receive a notification through here, through the portal, and you'll be able to see a notification here. So for example, just to show you what an example of a notification looks like, is we'll go through this thermometer reading. Oh, sorry, that's a check-in. If you see any type of readings that are too low or too high, especially in the thermometer, most of the ones you want to be focusing on is the high readings, you'll be able to set the range, and anything that's outside of this particular range will be shown up as a notification here. You're able to see a list of every single device from all the patients that you have and what notifications are occurring with them. So what that means is that you're able to pinpoint the specific patients that might be having an issue. In the sense that, in this particular program, no news is good news when you're looking at a device, because when you come in here and you see everything looks normal, then that's a very good sign. You don't want to see a whole lot of red coming through, simply because that means that patient is maintaining their normal levels. They're not having any type of episodes. And that's the whole idea behind this program, is that we want to get patients to a level readings. We want to get them normalized and then continue to have that monitored. So that way, when if a patient's blood pressure spikes or drops, that they might be having an issue with medication that they're taking, or they might have a type of a heart arrhythmia or anything like that could affect that blood pressure, or scale reading. Same thing with weight. If the patient's weight shoots up drastically, they might be retaining fluid. Again, it all depends really on the specific condition that patient has. And as you see here, every time I click on a new device, the eyes of Medicare, in terms of the time spent on it, is that each device reading that a patient has counts as a minute of remote clinical time. And the reason why that's important is that we track all of the actions that are taken with a particular patient. So far, as we've been on looking at this particular test patient, we've spent a total of 7 minutes of remote clinical time looking at this patient's information and data. And what that means is that in terms of the Medicare billing codes, you're required to spend 20 minutes at minimum each month with a particular patient in their data. And that means you can, and everything counts. And what that means by everything counts means if you place a phone call to the patient, the entire time that you speak with the patient on the phone is considered remote clinical time, and that is added here. Anytime you come in here and like do the review readings like we did here before, like you saw me do with all those devices, that counts as time spent looking with the patient's data. So the reason for that is because Medicare wants to ensure that a healthcare organization isn't just recording the data and then having it sit somewhere. The idea of the program is to have that data monitored so you know and catch things on each patient and really bolster, again, that relationship between the primary care physician and their patients. You're going to be able to practice much better medicine when you have readings of their weight and their blood pressure or their pulse oximetry. If you have those readings on a daily basis or every other day, you're going to have you have so much more data to be able to practice better medicine because you understand your patient's health and wellness much better than you would seeing them every 3 months or so. You get much more accurate readings on what their actual blood pressure, weight, and things like that are, and you also again get ahead of any types of issues that if you see a patient has had a flare up in their blood pressure for 3 days, it might be time for them to come in or maybe change their medication or whatever issue, or even just have a phone call and speak with them, see if they're having any types of issues. It's really to get ahead of the patient needing to ignore any types of feelings of them having chest pains or anything like that could turn into a heart attack. And then having to go to the emergency room. The idea here is that within the Medicare billing, the Medicare program is that they want to A, collect the information from the patient, and B, make sure that information is being monitored. So in terms of the billing portion of this program, there are 2 main billing codes that need to be acknowledged. And the first being CPT code 995454. And what that is just the collection of the actual data from the patient. So as long as a patient records at least 2 days worth of readings, meaning they utilize their devices on 2 separate days in the month, the idea is to have them do it much more often than that. But the minimal requirement is for them to have at least 2 days worth of readings from any of their devices throughout the month. That is a billable code that's average, depending on your state, around $54 a month. Now, again, that varies within $1 to $2 depending on what state you're in, but the average is $54 a month. And then the second billable code is CPT code 99457, and that is the actual review of the data. So when you're looking at that's the remote clinical time. I mean, that includes the review of the data or even speaking with the patient, and that it can also include calling in a prescription for the patient if they need to go and change their medication. The time you spend with the pharmacy can be logged in here as well. So you're able to, and what you see here that our portal is automatically capturing the time you spend looking at the data, and say you want to place a phone call to the patient. Our portal will automatically collect that length of the phone call and add that to the work log as long as you initiate that phone call here through the portal. Now, the way this works is it just simply you type in the number that you want to be calling from, meaning your office phone or cell phone, and then you hit call, and that'll trigger a call to your device. It'll call the patient's number here once you hit 1, and then as the call is forwarded to the patient, it's going to show up as the practice's caller ID. They're never going to use whatever phone you're actually having in your hand. It's going to show up as the practice's caller ID, no matter what phone you're using to contact the patient. But as long as you initiate it through the portal, that call time will automatically be logged here. Now, you do have the ability to manually add time in here. Again, for example, if you call the pharmacy to refill a patient's meds. You can type in the note of which medication you gave them, and then the amount of time it spends. So say it took you 5 minutes to fill, a new prescription for a patient. You add that time in, and then it's added here. And you see here that now, even during this time, that we have now spent 13 minutes of remote clinical time with this patient. Obviously, the 5 minutes would have been an actual phone call with the pharmacy, but still, that's something that you keep in mind of, that the ability, and the idea here is that you log in and you review these readings and things like that on a regular basis. Typically, the way most practices redo it is about every weekday you come in and look at the patients that you have enrolled. And if they have, say, 3 devices, you're going to be averaging 3 minutes every single time that you log in and look at a patient. So if I come in here and say I click on my patient here, so for example, and I want to look at these are the patients that I have enrolled in my remote patient monitoring program. I want to come in and I take a look at their devices. I see this patient. Their body temperature is a little low, nothing alarming, it's fine. And then their blood pressure looks okay. So I go to the next patient. And what this button does here is just takes you to the next patient's devices. And so right here, I'm going through, I see this particular patient, look at their scale, looks fine, even though those weights were probably not quite fine. Even though this is a test portal, so just keep that in mind when you look at these numbers. I take a look at their pulse oximetry. They got some things I might need to clear. Then I take a look at their blood pressure. They take a look at their thermometer, and then their spirometry readings. Now, right there, in the eyes of Medicare, the fact that we looked at all 5 of those devices and made sure that everything, there's nothing out of the ordinary with it or anything like that, you'll see here that this is me logged in as this is the individual that reviewed it. I was able to collect that time for this patient. And then you go to the next patient. And I come to the device logs, and I can, again, you don't need, it just helps. It's a very quick process to be able to go through and make and check on the most recent readings that these patients have had. And each device that you look at, again, is a minute. So if you have about 3 devices, each patient, you're going to average about 3 minutes every time that you check on their readings. And again, the idea here is to make sure that you're getting ahead of any trends that you might be seeing with a particular patient's blood pressure or, weight, whatever devices you might be having or might be monitoring. And again, you can go through to the next, and then it's just a quick way to cycle through the patients here. So you don't have to come out and then click on a new patient. It's just a pretty quick work through on the portal. And again, you can always start off with just going through the notifications, the ones that are abnormal readings that you might need. Now, obviously, this is a ton of readings here simply because we're doing testing and we haven't cleared them off. Typically, the idea is when you first log in, the ones with abnormal readings are going to be the first things you see when you log into the portal before going to all your patients. So just keep that in mind as well. Now, one thing to touch on as well in terms of the financial side of it with the billing is that there's also an additional billing code. It's CPT code 99458. So if you remember, 99457 is the first 20 minutes, which is worth about $62 a month to the practice, meaning that first 20 minutes you spent with, and also the readings that you collect from the devices should be worth a minimum of each as long as you get that first 20 minutes, that patient should be worth a minimum of around $115 a month to the practice. Now, the beautiful thing about the remote patient monitoring is that if you do go over that 20 minutes, every 20-minute threshold is an additional billing code that you can submit for Medicare, and that is the CPT code 99458. And what that means is that you're able to bill an additional $43 for every 20 minutes that you submit with the patient. So if you are reviewing a patient and say, like I said, if you're doing it every weekday and they have 3 devices and you're going through each day and checking their readings, you're averaging at least 3 minutes a weekday of remote clinical time with a patient. So that's about 15 minutes a week. At the end of the month, you could be at the 60-minute mark, which would be an additional, which would be 2 additional billing codes on top of the minimum, which basically nets out to just over $200 a month per patient. Now, what we found is that patients on the program, they're averaging just over 40 minutes of remote clinical time, and the average compensation that is coming to practices per patient of the ones that we actively have on the program is around $150 a month. So just keep that in mind on the, and that's per patient. So, if you have 100 patients, that is about what the average you could be getting from each patient a month that we've seen in the actual practice of it. Obviously, the higher end of it, we have seen some with including the telehealth visits and things like that. The entirety of their remote billings can be much, much higher than that. But just to keep in mind that the average that we've seen is around $150 a month. Now, the next thing I want to touch on is the check-in surveys. Now, this is part of the chronic care management, which I'm sure many are already familiar with, as that has been around for about 5 years now. And chronic care management is a very similar program to remote patient monitoring. Now, they can be billed concurrently, or a patient can be participating in them concurrently. They have to be billed separately. And what that means is that the time it's basically the only overlap between the programs, other than the fact that you're getting data from the patient and things like that, is that you have to spend, again, 20 minutes with the patient's recorded data. And what I mean by patient reported data is that when you're putting devices in the homes, you're getting the information directly from the device to the hub to the portal. The patient is not submitting it themselves. You have the access to the actual readings coming from the device itself. When you're doing chronic care management, the patient is answering questions and and most of the time they're subjective, and the patients are reporting it themselves. And what we do with our system is we have an automated IVR call that is placed to the patient and then ask them questions. Now, again, this can be done for any type of condition. Currently, we have 97 different conditions that have automated surveys for. We are able to create any sort of custom questioning for any patients for any reason. As you can see here, this is our COVID-19 survey. This is a very easy way to monitor a patient's condition. If they, first question we ask is, are you feeling well? Been coughing a lot lately. And what we do is it's the same concept as the devices, where you're notified if there's a negative answer to any of the questions. So if you see here, this particular patient has been coughing a lot lately, and they have been short of breath without any physical exertion, which are very major symptoms of potentially having COVID. So at that point, the practice can reach out to the patient to try to set up a COVID test if they need it, or maybe set up a telehealth visit with them to talk and have them quarantine, things like that. It just allows you to monitor your patients on a wider level, and it turns your existing office staff being much more effective and much more efficient in handling a larger number of patients. One side effect, or one benefit really of this program, is that this can actually increase the amount of in-office visits that you have, simply because if you see a patient has had an increase in blood pressure, you can call them and try to say, hey, I've noticed, Mrs. Smith, I've noticed that you've had your heart rate's increased and your blood pressure's starting to top out a little bit, and maybe it's time for you to come in for a checkup, or let's discuss your medications and things like that. And you can have the patients come in, maybe for if they need to do additional blood work, or if any types of tests that you need to run. You will have much more data to be able to go off of to make those diagnoses, and allows you as an organization to really be more in tune with your patient's wellness. And like I've been harping on the entire time, it's really to get ahead of any types of episodes that might occur with the patient. You know, the best patients on this program are the healthy ones because you want to maintain their healthy status. You obviously, if they have conditions that you want to continue to, that have particular things you want to monitor, those are also, that's very beneficial as well to be on this program, simply because you're able to make sure that that patient's particular condition is still within, it's still in normal levels and is not causing problems for them. And you're doing this on a regular basis, so it really cuts down on the amount of time that you basically want to not have to contact your patients on a regular basis. You want all of their readings to be normal on a regular basis. And so that's kind of the idea of the whole program. And again, each patient's also going to have a care team involved with it. So it doesn't necessarily have to be the MD is the one reviewing the information. You're able to have physician's assistants, nurse practitioners, registered nurses, NMAs are able to be involved in monitoring these patients. And so you're able to create a care team that can be attached to each patient. So that way you'll have multiple individuals have the ability to come in and monitor them. Even if they're not in the office, staff members are able to log into this portal wherever they have internet access. And so if you are like some practices that are operating with kind of reduced staff, they're kind of cutting, every other day and things like that with their staff, they still don't have to, the staff can still work from home on the monitoring side of things. Because due to COVID, we know that a lot of waiting rooms in offices are operating at a little lower capacity due to, making sure you don't have too many people in one area and things like that. So this is something that allows an organization to still care for its patients. In our minds, practice much better medicine because you're getting much better data and spending much more time with the patients than you otherwise would. And also, there's a financial benefit directly for the practice as well. So with that, I will leave it here.